So that leads nicely, Annie, to what I was going to ask next then. So what should a medical device company, startup, what should they be doing in terms of resources to plan for this roadmap and to CE or UKCA marking?
Well, that's a really good term, a roadmap. I like that. I use that a lot. You do need a roadmap. You need a plan to follow, not only with timelines, of course, but with resources in general. So what is it going to cost you just to get the regulatory approvals in place that you need? And what is it going to cost you to achieve all the compliance that you need to demonstrate to those bodies? So there's two aspects to cost. That second one requires you to implement a quality management system. Now, I wouldn't like to say how many times I've been approached by project leaders and managing directors of companies to say, oh, Anne, we've got this fantastic new technology and we're getting ready to take it into clinical trials, or we're getting ready to take it onto market. We just need the absolute basic of a quality management system to get us going. There is no such thing as a basic or light quality system. You need to get a quality management system in place, and that's across the board. Quality systems are just a formality about documenting and defining how you are going to do business. And that's everything from device development to actually taking orders from customers ultimately. So, and beyond that as well. In the post-market phase, there are things to do. So getting a quality management system in its full compliant way, to be compliant, that is with the standard, that's ISO 13485, and getting it in early enough are really critical. So that's job number one, to get that off the ground. So you need to get your head around what's in ISO 13485. And I suppose in order to do that, then you'll need to probably recruit somebody or employ maybe an external consultant to help you with that journey. So to understand what's required and how to document it all, how to get the records in place. Because by the time you make that application to the notified or approved body, you need evidence, objective evidence, and that can only be created, well, ideally contemporaneously with as things happen. So as you implement your purchasing procedure, as you select suppliers, and those things happen quite early on, you need to be recording what you did, how you went about it, the evidence, copies of supplier certificates, for example. When you recruit people, you need to have CVs, you need to say how you think they fit the requirement for various roles and so on. So those are just little examples that happens across the board. But I think people shy away from the idea of a quality management system because they think it's difficult and onerous and annoying in some way. It's really not. It's about defining good what's the word, common best practice, business practice, and using common sense.